So we'll get straight into it. And just for us to really understand the context and just introducing our discussion here today. Our first question will be taken up by Dr. Emma. So Emma, your question will be, given Africa's unique landscape, what essential competencies do African healthcare professionals need to develop to address them effectively? Um, for since we're riddled with the whole burden of infectious diseases, maternal health outcomes, mental health, what do you think African healthcare professionals need to develop to address these issues effectively?
Thank you, Cinnamon, for the question. Please let me know in case my connection would be unstable so that I switch off my video.
Sure.
I hope you can hear me very well.
Yes.
Okay. Thank you. Africa carries the world's largest disease burden, and it experiences the most severe shortage of healthcare workers. And across the continent, the accessibility to primary healthcare is one of the greatest challenges. A possible solution is the implementation of the universal healthcare, which can provide access to treatment for more common ailments to the nations of the entire continent. And the right to universal health coverage means that all people, regardless of where they live, have inherent right to adequate and reliable healthcare provisions. And this should include access to healthcare providers, access to essential medicines, and access to preventive intervention and treatment services. In most African countries, professional healthcare services are usually concentrated in urban areas, and that leaves the people living in rural areas unable to access even the most basic levels of preventive healthcare. And the people living in rural areas are about 56% of Africa's entire population. So Africa is currently experiencing the world's highest rate of urbanization, with roughly about 65 million additional urban residents every year. And many of those moving to the cities live in informal housing, where access to clean water and sanitation is quite limited. And the consequences of this, when it comes to curbing the spread of infectious diseases, are very clear, as we saw with the COVID-19 pandemic. In sub-Saharan Africa, the sub-Saharan Africa is home to like about 17 million internationally displaced people, according to the United Nations Refugee Agency. And these displaced people are more likely to live in close quarters and in conditions with poor sanitation, with poor hygiene, and they have very little access to healthcare, particularly preventive primary healthcare. And in these environments, infectious diseases spread very quickly, as physical distancing is almost impossible. So we need certain competencies to be able to address some of these challenges. And first, economic investment in healthcare workers and infrastructure can help in building a more resilient medical landscape, and one that is able and ready to withstand the future healthcare challenges. Human development, education, and improved governance can also help to build the healthcare systems across the continent. And if we give every person in the continent a certain minimum level of education, they can also become catalysts for developing our system. Training of healthcare workers in the continent, and especially on skills that we are short of, and having also international collaborations could also bring knowledge from outside the continent as well, and allow us to share our own developments and perspectives. Specifically, for example, for infectious diseases, we need a public health response. For example, for an outbreak, an epidemic, or a pandemic, we need preparedness, swift response, and appropriate action for case definition, identification of cases, which includes testing and diagnosing, and contact management, isolation, and support as well. And generally, healthcare needs to be seen as an investment rather than being seen solely as a financial or an environmental resource. and leadership needs to renew conversation with the sector to reassess the role of health systems in the society. And by addressing the healthcare sector's needs, we will be able to, and enabling healthcare and by addressing the healthcare sector's needs, we are enabling healthcare and innovation, not just for the present, but also for the future that will require it. Thank you.
Thank you so much, Emma, for just painting that picture for us and for really kickstarting our session today. That was definitely insightful. Over to you, Dr. Francis. With the rapid pace of technological advancements in healthcare, how can African medical schools adapt their curriculums to cultivate a future-proof skill set in their students? Dr. Francis, can you hear me?
Hello, good evening, everyone. Can everyone hear me now?
Yes, we can hear you.
Oh,
Sorry, have we lost Francis, or someone please confirm? Emma, could you kindly confirm if
hello. Can you hear me?
Yes, we can hear you.
Okay. So I'm sorry about that. I mentioned earlier that technology is rapidly advancing and evolving and affecting various sectors, not just the health sector. So as healthcare workers, if we do not evolve with the times, we find ourselves outdated because technology is taking up space in a lot of things now. And technology is also helping make different industries better and more optimal. But taking off from what Dr. Emma already mentioned, there are some systemic issues that already put us like 2 steps backwards when it comes to implementing technology. So you cannot say that for a continent that has so many internally displaced people, a continent that has a lot of people in the rural sector who do not even have access to basic health care. So it's going to be very difficult for technology to be able to get to them because systemic issues would prevent them from having access to technology. For you to be able to use technology, you have to have electricity to charge your gadgets. For you to be able to use technology, you have to have stable internet supply. So while technology is good, before we talk about equipping our future leaders with the skill set to be able to use technology and utilize technology effectively, we have to first address those systematic issues that would even make it impossible to begin with for anybody to be able to enjoy the benefits of technology. So once we have been able to address more systematic issues, we find that the healthcare and technology are interwoven. So in cases like in the rural areas where people do not have a lot of access to healthcare personnel, if we have access technology, we have things like virtual consultations. But once again, if they do not have access to electricity, they do not have access to stable internet supply, they won't be able to access this. So the first thing is to ensure that policies are made to be able to improve the environment for technology to thrive. So once we are able to have that, then we can begin to adapt our curriculum to be able to ensure that our healthcare professionals are adapting to the new times. So first of all, we could have things like digital health. They could have courses on digital health, ensuring that our curriculum is not rigid and just teaching them only the medicine. So we could begin to incorporate things like digital health, healthcare courses, technology, begin to teach our students while in medical school how to be able to use this. Doctors should be able to use a computer. Doctors should be able to be taught how to consult virtually, such that even if we do not have enough hands, you should be able to take advantage of technology to help with health. Then we also realized that no man is an island of knowledge. While our students are learning medicine, you could always have collaborations between them and people from other disciplines like engineering, like data science. So when you have interdisciplinary collaborations like this, you could always put it in maybe in a semester, they take a few courses with other people. It also builds this culture of working together and we can learn from each other. So this way, we can be able to adapt our curriculum to give our students the necessary skills that they need to be able to access technology and utilize technology effectively for medicine. So it has to start from the grassroots. While they're in school, they have access to electronic medical records. These are the uses. This is where health and technology intersect. But if we don't train them from the point where they are students, you find that it becomes next to impossible for someone who has always been writing down with their hands to get used to typing on a more efficient system. For example, the electronic medical records helps us keep data more effectively. Papers get lost. And in some hospitals, in fact, in many hospitals in sub-Saharan Africa, till date, we still have manual record keeping, and they keep files and folders that a lot of things can happen to. Things get missing in transit. So you see that technology is evolving beyond the point where we can still rely on those old methods. So we need to move forward. One more thing we could always do is research and innovation. Now, research and innovation would always help any field. So if we are able to put money into technology, we find that there's a lot more research opportunities for students. There's a lot more flexibility for students. Students are able to, while in medical school, still have a degree in tech. It's possible. Students would leave the mainstream field of just focusing only on clinical medicine, and you can also have a field where they have digital health, people who are medical doctors trained and are still technology enthusiasts. These are the people who are going to delve more into these research opportunities. But once again, it always has to be introduced right from the scratch. So I think these are the ways we can adapt our curriculum to be able to integrate technology into health for the very, very good uses that we have. Thank you very much.
Thank you so much. Oh, powerful insights. And I think Joshua also agrees. Like, preach, doctor. A very powerful point, and bringing out the importance of interdisciplinary collaboration, the whole role research and innovation plays in all this, and how we can be able to adapt just right from the start when we start medical school or undergraduate, and how we can be able to incorporate technology, digital innovation in how we're able to relay knowledge and information. So thank you so much for sharing that. Back to you, Emma. The landscape of healthcare is evolving, and that also preempts like patient needs are also evolving as well. How can we ensure that tomorrow's healthcare workforce is prepared to address issues like mental health, chronic diseases, and personalized medicine?
Thank you for that question. So many countries in Africa do not meet the WHO healthcare worker to patient ratio, and accessible health services require a sufficient number of skilled healthcare workers to meet the population needs. And however, the workforce shortages do not allow the population needs to be met due to restrictions. For example, restrictions by professional boundaries, which I will come to a little bit later. So these boundaries reduce the flexibility of the health workforce and also introduce additional transactions and costs, which may deter people from seeking further healthcare services. And tomorrow's healthcare workforce can be prepared to meet the evolving needs of the population by increasing the flexibility of the healthcare workforce and addressing the boundaries that reduce the ability of the health workforce to respond to the needs of the population. And I would like to talk about 4 principles that can potentially help to increase the flexibility of the workforce. And the first being measuring the health system performance from the patient's perspective. And accessible care from a patient's perspective can be just provision of appropriate care at the right time and at the right place. And this may be different, when viewed from the lens of a healthcare practitioner or a public health practitioner. So this patient is here with you. The patient needs a certain service to be provided. So long as the patient gets the service provided by a skilled professional, the patient is absolutely all right. But a healthcare practitioner or a public health professional will tell you, might tell you that this patient, for this to be, for us to say that this health system has performed very well, we might need to have a certain specialist like perform a certain procedure on this patient, but with our shortage of workforce, when someone is skilled enough to perform a certain procedure, they could help and bridge that gap. Also, matching rewards with the skill level and not the professional title. For example, you can have a consultant who is not very skilled, and you can have a medical officer who has practiced in that field for a very, very long time, and they have a bit more skills than the consultant who most of the time just shows up and doesn't actually do things. So like if I'm rewarding you for this, like what do you have to show for it? What skills do you have to show for this thing that you're getting rewarded for? And also ensuring that practitioners have all the skills they need to perform the required tasks in their work environment. And we understand that by the time someone is beginning to practice, they might be deficient of some skills, and this can be that gap can be bridged by capacity building in the deficient competencies, and also enabling health practitioners to work to their full scope of practice. For example, if a medical officer is competent enough to perform electroconvulsive therapy in a mentally ill patient, and the psychiatrist is not around for some reason, like why should this patient miss their scheduled session of treatment just because the psychiatrist themselves is not there to perform this ECT? And the same applies to other things such as cesarean section. So I think what we need to focus more on is the skills and not necessarily the titles. And if we are able to train more people, if people are able to like gain more skills and able to help out with these workforce shortages, a lot of gaps can be bridged. Thank you.
Thank you so much, Emma, for painting that picture and the principles you've highlighted. I think that's a very important one. You've said, and the point you've said on not really about the title but the skills. And I think ensuring that passing down of skills, we don't have to really ensure that the right person. Just have to ensure that you have the right skills to perform something, and of course, cultivating wanting a learning spirit and getting to understand what is really expected of us is really important. So thank you so much. Given the ever-changing, on to you, Dr. Francis. Given the ever-changing public health landscape, how can we cultivate a culture of lifelong learning and adaptability among future healthcare professionals?
All right, thank you very much for that question. So public health is also evolving. We have to deal with different diseases at different times. For example, when COVID-19 came up, everybody had to adapt. There had to be new strategies so that we could combat the pandemic. Nobody knows what we're going to face in the future. We don't know what public health concerns may pop up, and public health issues vary depending on geography. For example, we have a lot more communicable diseases, and at some point we are realizing that we are transitioning from the infectious disease phase now into more non-communicable diseases. So you realize that ability to adapt to the changing landscape is very important when they are practicing as doctors. So as students, it's important to first of all imbibe the culture of lifelong learning. As medical students, you're told that the learning never ends. So the one thing that you're sure about is that there would always be new knowledge. So putting that into perspective and ensuring that students are aware that things change at different times, so they should always have this culture of lifelong learning. And even when they've graduated as doctors, it's also important for updates on their learning to also be done, because what was obtainable 20 years ago is no longer obtainable We're getting new guidelines. We're getting new standard operating procedures. And as diseases are evolving, we are also evolving with them. So ensuring that we put in continuous education and opportunities that will always help them stay updated, giving them access to the latest guidelines. So our curriculum cannot be what was obtainable 20 years ago, and you expect to raise medical practitioners, future health practitioners that would be able to evolve. So we have to also evolve with our curriculum, making sure that we're updating with the latest guidelines and giving students access to these resources, giving them access to conferences, even while as students. So when they go to these conferences, they attend these conferences, they get new knowledge, they mix up with new sets of people, they learn from others, and they learn not just within the classroom. So the focus of learning has to be taken solely away from the classroom. So the classroom is very important as medical practitioners and as students, but the emphasis should not just be 100% on the classroom alone. There should be other opportunities outside of the classroom for them to be able to learn. So conferences, seminars, they have journal club meetings, and all of those things are very necessary to create the mindset of adaptability and lifelong learning, honing their creativity as well. Gone are the days when doctors were just always fixed to only medicine. Doctors are into music, doctors are into arts. We have things like art in medicine, where people use arts to provide some form of soothing for patients on the ward. So encouraging that form of creativity and honing their creativity, even as students, helps reconfigure their mindset. So they're not just fixed on listening to one thing or just following one direction. Now, when medical students look up to their senior colleagues, people who are doctors, people who are professionals, people who are professors, and people who are ahead of them in the field. So seeing these people also adapting and learning from them in the form of mentorship opportunities and the likes would also open up their minds to the fact that there's a lot more in the world, there's a lot more to medicine than just bedside work. There are different ways they can come in. Everybody is also not built for bedside work. So it provides them with a more holistic education, and it will more encourage diversity for them. Now, while students are in medical schools, we have competitions that help hone their creativity, open their minds up, things like hackathons and all of that. So ensuring that you encourage them to participate in these competitions or brainstorming sessions and all of these things. These are the things that produce a more global or more well-rounded doctor, as opposed to somebody who is just solely fixed on the letters, solely fixed on what is in the textbook, solely fixed on what is happening on the wards, solely fixed on what is happening in the clinics. So with this expansion in mindset, exposing them to various opportunities, making them know all the opportunities that exist and in all the different ways they can come in as doctors, not just clinical medicine alone. I think it will encourage this culture of lifelong learning and enable them to know that they always have to keep updating themselves, and then ensuring that you give them access to resources. Very important. Resources are so that you cannot overemphasize that. It is knowledge that makes people know, oh, there's so much more, there's a lot more out there. But if they don't have access to that knowledge, so our libraries, online repositories that students should have access to, once again, still playing into technology, would help them to be able to have this culture of lifelong learning and always updating themselves and updating their skills. And eventually you realize that the continent will be much better for it, because we'll have better doctors, and we have doctors doing a lot of good things in other fields. Yes. So thank you very much.
Amazing, amazing. I totally agree with you. And if I were able to sum up what you've said in terms of accessing resources and opportunities, I can't help but think that some of the opportunities we've had here in med school are being able to serve in FAMSA, being able to get contact, because I think it's through FAMSA you have that platform to interact with senior colleagues, people from different countries as well, and getting to learn from each other, getting to interact, knowing what's going on within the continent and what's affecting the public healthcare space. And it's definitely a very good opportunity for students to be able to leverage and getting to learn and be adaptable even as they're reading and striving to become better doctors in the future. So thank you so much for that. On to you, Dr. Emma. Beyond technical skills, and I think Dr. Francis was able to paint this really well. Beyond technical skills, what strategies can be implemented to foster innovation and critical thinking within the future healthcare workforce?
Okay. The place of innovation and critical thinking in healthcare cannot be overstated. And innovation in healthcare improves the efficiency, the effectiveness, the quality, sustainability, safety, and even affordability of healthcare. And critical thinking, on the other hand, is an essential process that's necessary to provide efficient, safe, and skillful healthcare. And healthcare workers who use critical thinking skills become influential in their decision-making, resulting in enhanced effectiveness and even more favorable patient outcomes. So fostering a culture of innovation in a healthcare setting means creating an environment where new ideas are valued and experimentation is encouraged. And this can be achieved by establishing innovation hubs, pitch days, hackathons, or even incubators where staff can work on pilot projects. The healthcare managers also need to create a culture of active learning, foster a culture of inquiry, and emphasize on real-world application and relevance and not just the theoretical aspect of things. And they should also incorporate reflection and feedback so that people are able to think back and reflect on their actions and the potential options that they had and see how these their actions and their choices actually affect things. And then they can give feedback, and the managers should also support continuous learning and improvement among their staff. And this means providing opportunities for staff to update their knowledge and skills and learn from the best practices and share their insights and feedbacks. And this can really help build the healthcare workforce, the future healthcare workforce, through innovation and critical thinking, so that people do not just do things because that is the way they're supposed to do it, but they have actually reflected and they have acquired skills and they have acquired a professional identity, and they really, it's actually in them that they do this because of this and not just because that is how it's supposed to be done. Thank you.
Thank you. Thank you so much for that. And as you were speaking and you mentioned your first point on innovation hubs and hackathons, which has also been very much echoed in the previous questions, is I'm seeing more of these initiatives coming up. And it's no longer about whether you're passionate about the digital health enthusiasts or like people who are, you know, the people who are passionate about these things, but it's starting to come up really a lot in terms of encouraging medical students and people to take part in such conversations, because we do acknowledge that as a healthcare space is constantly evolving, we do need to be able to equip ourselves with technical skills that can be able to help us provide better care or become better healthcare leaders in future. And it's truly important that we are having that conversation right now. So to our audience, I know I've neglected you guys a lot, but please feel free to drop a comment in the chat section or any questions. I know we'll be getting very soon to the Q&A segment, but feel free to utilize the chat section for any interactions, any specific questions to our panelists. We'll be happy to take them. On to you, Dr. Francis, once again. Effective leadership and communication are vital for successful public health initiatives. How can we equip future professionals with these skills to drive change and build strong teams?
All right, thank you very much. So leadership and communication skills, how to be empathetic as a leader, how to be ethical as a leader. These are soft skills. They're not things that you necessarily get within the classroom. And we already know how bad leadership is even affecting the continent. Let's not even speak about the health sector alone in different parts of the continent as Africa as a continent. Leadership and a proper political will is affecting everybody. So it's important for students to know how to be proper leaders, know how not to be authoritative, not to think that as leaders, they just have to dictate for everybody. Because if you don't collaborate as a team, these public health initiatives fail. It's a well-oiled machine where all the parts have to work together. But without effective leadership, everybody's just going to be clashing. And we find now that, okay, we have somebody within the NCDC, we have people with the World Health Organization. These are leaders. These are people who are taking active steps to improving the public health. So if these people never learned how to be proper leaders, when they actually got to these positions, you would realize that it will be very evident when somebody is a terrible leader and when somebody does not know how to communicate within a team, somebody is not a team player. And we are also accused as medical practitioners of not being able to be team players, of thinking that you're like the Lord and Master of everybody and not realizing that you have to work hand in hand with everybody. So how do we inculcate this into our students? Really basic, starting from their organizations within school. So you have a lot of organizations as medical students, you could have religious organizations. Encouraging students to serve in these capacities teaches them how to lead, teaches them how to work with others, teaches them how to organize a team. Because leadership isn't something that you can sit down and just teach someone didactically. You have to experience it, you have to learn on the job, you have to make mistakes and get corrected. So it's hands-on. It's something that they have to practice or they have to try their hands on it. Student leadership, you have maybe student governing bodies, you have even as class, just as a class, you have someone who is the class representative, the group representative. So encouraging students to take up these positions would help them hone these skills that they need, things like communication, things like empathy. Now, they would not be able to take the skills effectively if they don't have people to look up to. So to be able to raise good future leaders, you have to give them good examples of future leaders. So the heads of our institutions, the heads of our medical schools have to be an example, a shining light, such that students want to emulate them and learn from them. And people actually learn from what they see you do, not necessarily what they hear you say. So when students can watch their teachers, their lecturers, their vice chancellors actually demonstrating good leadership skills and good leadership practices, you realize that they begin to imbibe that because that's the culture they've grown around. So as the trainers are training them medically, teaching them about the diseases, they also have to be good examples and show them how to lead and give them opportunities to lead, because good example is really going to do a lot more for that student than just telling them, oh, this is how to be a good leader, this is what you need to do, these are the skills you need to take. And it still goes right into mentorship again. People who are interested in leadership positions should be able to learn from mentors, should have direct access to mentors for questions, for maybe when they have challenges, how do I navigate this particular challenge? To whom much is given, much more is expected. So it is whoever is faithful with whatever is little, you're in your little corner as a student leader or student advisory council, that is still the same energy, the same work ethic, the same communication style that you are going to take, even if you're translated into a global scale or you go over to the African CDC. It's the same things that you've learned while you're a student or even post-grad that you're going to implement there. So hands-on opportunity as well, give them opportunities to lead projects. You have outreaches, they organize these things. It makes them have to work with other people. They'll have to work with epidemiologists, you'll have to work with nurses, you have to work with technicians, you have to work with everybody and make everybody feel valued. So when you have these things, you realize that you raise better leaders, people who are good followers and better leaders, people who would listen and be team builders. And then the last thing that also helps raise great leaders is team bonding exercises, collaboration, interdisciplinary collaboration on these projects. You can't just raise your students in a vacuum. So only medical students are having things with each other. They should be able to collaborate on projects with people from other disciplines, because they need to know that they have a lot of things to learn from others and others have a lot of things to learn from them. So these collaborating opportunities help them to work better in a team. And that is one of the things that a good leader needs to do. So I think with all this, you are able to raise better leaders as students, and they will translate into better leaders even after graduating from school. Thank you.
Sure, amazing. Great insights there. And of course, we have been painted as not the best, basically, people in the healthcare profession have been painted as not being the best communicators. But I think that is gradually changing, and we're becoming more self-aware and empowering ourselves with, communication skills. And I think that's really super important. And it all starts really from now, even as you're transitioning and hoping to become public health leaders or great people within the space. So thank you so much. We're almost coming to the end of our discussion here today. And still on to you, Dr. Francis, in terms of bridging the gap, what concrete steps can African institutions and organizations take to bridge the gap between identified competencies and current educational programs?
Okay, so Dr. Emma already mentioned the competencies and where we're lacking. So one of the first things you already mentioned, the African institutions, our leaders, our public health institutions. When you identify the problem, that is one of the first things. You already identify a gap and you can provide a solution to it. So identifying these gaps in our curriculum, these gaps in our training is the first step before we are able to bridge the gap, before we're able to, help our students. So if the people at the helm of affairs do not know that we have issues that need to be sorted out, such that we are raising students who can compete globally, then we will not be able to get anywhere. We will not be able to move anywhere. I would say that our curriculum needs a very, very, very heavy curriculum overhaul. We have to have a revision of our curriculum. That is one step we could take, because our curriculum is lacking in a lot of soft skills that people need to function in the world today. Curriculum is lacking in a lot of things like technology, that our students need to function, that they need to be to raise holistic doctors, to raise doctors who can thrive in whatever environment you put them in, and who can actually innovate so that we don't keep having the same solutions to the same problems that we've always had from the very beginning. So changing our curriculum, not necessarily making us lose what's important, but realizing the value of other things that would create a more rounded person and not just a doctor who knows how to treat patients. So that is one of the steps you can take as medical schools. You can always revise the curriculum. That is very important. Investing in research and education. We need people who have research dedicated towards education, not just research towards public health improvement, which is very important and which also needs to be invested in. But we need education-focused research, because these are the people that can ask the questions. Research asks a question and then finds a solution to the problem. So they can ask a question and find out why we're facing these challenges. But if there's no investment into research focused on education, we're not going to be able to have actual scientifically based evidence that, oh, yes, these are the problems. We could always sit down and talk about, oh, I think this is a problem, this is a problem. But I think the problem is peculiar for different countries, even within the continent. So identifying each person's problem is really where research comes in. So investing in research is important. Driving conversations like this, we have this is a conversation, this is an eye-opener. So if we have conversations like this and we actually have relevant stakeholders who can implement these policy changes, or following meetings like this, we actually have like policy papers that can be written such that, oh, these are the problems that students are facing, these are the competencies that we're lacking in, and this is what we need, so that it could always get to the relevant stakeholders. Conversations like this drive change. It may appear like we're just talking here, but if things are actually well organized, you realize that it can actually get to the quarters where implementation can be done. So this is one of the ways you can bridge this gap. These conversations can happen within our local systems. It can happen within the country, it can happen within our law, it can happen within our lawmakers and the likes of them. Then our political will, because at the end of the day, if we could talk, we could have solutions to our problems, but if there's no political will to be able to drive the needed change, you realize that we'll just be stranded, running around in circles, talking about the same things, talking about the same solutions, but nobody actually taking active steps to bridge this gap. So I think these are the ways that we could bridge the gap as African institutions. Thank you.
Amazing. Thank you so much for sharing that and some of the practical steps that really can be incorporated even as medical students on how we can be able to bridge this gap. You've mentioned some of the key areas actually surrounding our educational curriculum and the need for research and innovation to be part and parcel of our discussions here today. So thank you so much for sharing that. On to you, Emma. And in terms, Dr. Francis mentioned a bit about collaboration and partnerships. And how can FAMSA, along with other stakeholders, foster effective partnerships to support the development of the future African healthcare workforce? And I think I'll be really noting this quite quite carefully. Please go ahead.
Okay, thank you, Sinowan. Taking off from where Dr. Francis has left, so partnerships for health are an important mechanism for health development, and the Africa Centers for Disease Control and Prevention called for a new public health order that is characterized by strengthened public health institutions, expanded local manufacturing, strengthened public health workforce, increased domestic resources for health, and most importantly, action-oriented and respectful partnerships. So partnerships usually don't just come about on their own. They need to be built with skill, with care, and with mutual trust. And there's usually a partnership strategy that needs to constantly bear in mind the following steps that I'm going to talk about. The first one is identifying opportunities. For example, if the opportunity here is development of a future African healthcare workforce, the next thing after identifying the opportunity for development of a future African healthcare workforce would be identification of potential partners. And that is where the Ministry of Health, the Ministry of Education, and other organizations such as the WHO, AMREF, Africa Centers for Disease Control, which would be interested in development of a future healthcare workforce for obvious reasons, because their mission, their vision is aligned with that. And after identifying the potential partners, you need to select the most suitable partners. You ask yourself, which of these organizations, which of these government entities, which of these NGOs are most aligned with this opportunity of developing future African healthcare workforce. Then you filter, you remain with your best, then you move on to the next step, which is negotiating and reaching a clear partnership agreement. And this is the most it can be very long, it can be very tedious, it can be disappointing, because the fact that you're negotiating doesn't really necessarily mean that the partnership will be successful. Sometimes you go to negotiations and you don't get what you want, but if you do it very well, if you go with it when you planned very well, when you're clear on what you want to partner on what you're going to offer, on what you're going to expect the other organization to offer, you can actually get what you want. And you need to be very strategic when negotiating, because your first impression will actually matter a lot to the person you're negotiating with, and how you present yourself the very first time usually leaves a lasting impression. Then after negotiating, when you have negotiated and you have come to an agreement, that's where the memorandum of understanding comes in, and the leadership of either party will need to sign the memorandum of understanding for it to be valid and for it to be accepted by both organizations. Then after negotiating and reaching a clear partnership agreement, you'll need to maintain the partnership. And sometimes after partnering with an organization, you might forget, and you might not actually hand over to the next leadership, and then information gets lost, and then the partnership gets tampered with. So it's very important to maintain the partnership and ensure that when you're handing over, you let the people who are taking after you know that this is how things were regarding partnership with so-and-so organization. This is what we were able to achieve. This is what we were not able to achieve. These are things we would want to achieve in the future. And these are the challenges that prevented us from getting like where we wanted to be by this time that we're handing over to you. This is how we were able to outdo ourselves in this partnership, and so on. So it's very, very important to maintain partnership and ensure that we hand over properly to the next leadership, and just have good rapport with our partners, because that is what keeps the collaboration and the partnership going. Then it's also very important to regularly evaluate the partnership. You need to come and sit down and ask yourselves, are objectives of the partnership being met? And if they are not being met, you go back to the drawing board and ask yourselves, where did we go wrong? What did we miss? What did we misinterpret? And how can we improve that? Thank you very much.
Thank you. Thank you so much for highlighting that, and the essence really around partnerships and getting to decide, taking charge of the conversation in terms of communication and monitoring and evaluating some of the partnerships that we have, and whether it is serving really the needs of the both organizations. So thank you as well. So we are actually at time for questions and answers. So if you have any question, please feel free to raise your hand. I think we had a question from Davis. Yeah, I think this was during Dr. Francis' presentation, and maybe you can also take this one, Dr. Francis. Is Davis asked, how quick shall we be to enforce that adaptability in medical school? It's already difficult to adapt simple changes in traditional teaching methods. So probably, Dr. Francis, you can take that one. Meanwhile, guys, if you have any question, feel free to raise your hand, or just type in the chat section, then we can be able to pick it up. So Dr. Francis, please go ahead.
I'm sorry, I didn't get the question.
Oh, all right. So I'll just phrase it. Davis asked is, how quick shall we be to enforce the adaptability in medical schools, given that it's sometimes really difficult to adapt simple changes within the traditional teaching methods? Yeah.
Okay. So do I go now?
Yeah, please do.
Okay. So, well, I completely understand the resistance to change in medical schools on the continent as a whole. But little drops of water make an ocean. Gradual steps eventually culminate in an overall visible effect. So it may not be something that, oh, we could just overhaul in one night, but if we take little steps, we actually begin to see some changes. And then it becomes like it becomes a rollover effect, such that when the changes and the impacts and the consequences are noted, it begins to become like a little more, gives more incentive for people to want to uh continue with this. So if they see that, oh, this is really good, just in your little corner, just one particular, maybe one conference, one hackathon, you have like a research post such, and usually data speaks a lot for people. Data does not lie. So if you could have something like that where you have maybe pre and post a session, and you actually show statistics and data that, oh, there has been 2% improvement, even if it's a little, you have something to be able to go to the relevant stakeholders and say, okay, because this has shown so much improvement, or we have been able to do this with the little that we have, and we think that taking it up to a global scale or to the whole of medical school would improve something. If you start from your past, it doesn't have to start from the top. It can start from the root. But somebody has to actually show data and actual positive impact that these steps, innovation, and this adaptability has actually put up in the life of students. So when they see this data, the resistance reduces. I'm not saying that it's easy, because we're very stuck in our ways, and it's difficult for you to want to accept that, oh, the way that you have always done it before, you feel like it's an attack on you, that you're telling me that, oh, what I have taught for 20 years, you can't possibly know more than me. But if you let them know that, oh, okay, based on the evolving climate, based on things that we have now, come up with papers, come up with collaborations, give them hard evidence to show visible improvement. And I think if you get them looking, at least you get there. And once you get their attention, you're able to now move over from there. And gradually you get a lot more impact that way than waiting for one big moment when everything is going to turn around. And just gradually you
Right. Thank you so much, Dr. Francis. I think maybe we had lost you a bit. You wasn't a bit muffy. Maybe it's internet or something, but I think I was able to get most of what you said, and I hope that question was duly answered. My question really also goes to Dr. Eva. While you were mentioning some of the key principles, you were able to mention the first principles about measuring health system performance from a patient's perspective. And my question would be, how can we be, looking at the landscape here in Africa, how can we be able to ensure that healthcare professionals are equipped to provide culturally competent and patient-centered care? Deriving from, getting to know from the patient's perspective on the health system performance and all that. Yeah.
So for the first thing that healthcare professionals will need to do is to get acquainted with the cultures of the people, of the populations they serve. For example, if you understand that people of this religion do not want a blood transfusion whatsoever, if you get someone with iron deficiency anemia, you should be able to prefer something that is not blood, maybe the iron sucrose that is intravenous and it's not blood. And you should also be able to put yourself in the patient's shoes, try to understand the patient and their needs, and not necessarily just, of course, you usually know what is best as a healthcare practitioner, but just try to understand where this patient is coming from, what they really want, because you could be wanting something for the patient, but the patient wants something different for themselves. And so long as they're of sound mind, that is absolutely okay, even if it's different from your view, because we have the principle of autonomy, which should be respected at all times. And when we talk about patient-centered care, we have to involve the patient in our decision making. we have to involve we need to be able to involve the family of the patient in the patient care. They should be able to understand what their patient needs, even as we uphold the confidentiality of this patient. They should be able to support this patient, and that even like promotes the acceptability of the like treatment options you're going to offer to this patient, because the decision will not be made by you alone, but it will be a collective decision that will be made by the team that includes you and the patient. So that is very important, and we need to recognize this cultural diversity, and we should not stigmatize anyone based on their cultural practices and beliefs, and we should just be able to like embrace diversity, equity, and inclusion.
Thank you so much for answering that question, and I think that was very quite extensive. Yeah, I see a hand. Davis, please go ahead and mute.
Yeah, I hope you can hear me.
Yeah, we can hear you.
Thank you so much for the conversation. They're really they're really great. Mine is a question to Dr. Emma. I think was at the same time that she was talking about the principles on how we organizations say like firms can be able to implement uh, some of partnerships, and according to my realization, maybe it's not right, but there seems to be a lot of politics playing around with the so-called stakeholders. The firms could have reached out, maybe collaborate with, where they don't seem to appreciate, or maybe uh, appreciate, or maybe give them a table, or maybe support, um, as they would have students, as students would have liked. Or they don't see that in students. Um, they don't pro- they don't provide that table where students can actually be able to uh, to implement some of these changes, or can be able to provide their ideas. How can we uh, how can we as firms, despite of these challenges, be able to mitigate or go around these challenges and still be able to produce something great around Africa, especially on medical and healthcare education?
Okay. Thank you, Davis, for that question. I totally understand what you're talking about, because I also experienced it. And some things we as medical students, even as we do our best, we have no control of. For example, you have no control of how a potential partner responds to you, but so long as you have given your best, that is enough. Politics will always be there. It has always been there. It will continue being there. And, as medical students, we are trainees. We do not have any certificate to show yet. So what I would tend to think is that they do not consider us as professionals, but I'm glad that at least they give us an audience for example, in the WHO Regional Committee for Africa. And sometimes I have seen them like really recognize the statements that we put across, and they even written down, and once they're written down, I think they are like taken up and might be implemented. I think there are some things that they can let us do, they can let us partner, and there are other things that they cannot let us partner in, because we are still students, we are still in training. You understand? So there is a limit to what can be given to us or not. All these organizations have policies, and for them to let you do something, you should be a professional in that field. And FAMSA is for medical students. people are not professionals yet, but I'm quite sure that if we were professionals, they would allow us to do some of these things, to collaborate and implement some of these things. Because again, even with their partners and their collaborators, it's not free work, it's work that is paid and so on, and they pay for the professional services delivered. I don't think they totally lock us out because there are things that they allow us to do. And I think that's quite fine, but there is still room for, I know that there is more we can do than what they allow us to do, but I also sort of understand them from their point of view. But I'm quite glad that they don't completely lock us out.
All right. Thank you. Thank you so much, Emma, and also Davis, for the great question. So time is far much spent, and I see no other hand. So thank you so much for the insights that you shared. So we'll move on really to closing remarks and get to hear from our speakers. And we'll start with Dr. Francis, even as you're giving your takeaway message. The Global Public Health Week has mentions peace as a key factor for achieving equitable health outcomes. Maybe could you elaborate on the link between peace building and the competencies required of future healthcare professionals as you're tying that to your takeaway message?
All right, thank you very much. I think this has been a pretty engaging conversation, and it's eye-opening for us to be able to look at the things that we need to pay attention to while we're students, things we need to pay attention to as young professionals. And like I already mentioned, is driving conversation, and that's one of the key to moving forward. Now, the link between peace building and competencies required of healthcare professionals. One of the first things mentioned by the Dr. Tedros for the WHO Global Health and Peace Initiative is there's no peace without health, and there's no health without peace. And as healthcare professionals, if we do not have, if there are no patients to treat, if we do not have good working environments, if the safety of healthcare professionals is not assured, we're not able to make any progress, let alone build any competencies. We wouldn't even have students, we wouldn't have doctors, we would not be able to function. So WHO Global Strategy for Health, human resource on health, they really want to pay attention to the impact and quality of like healthcare, human resources, welfare of healthcare personnel. These are the conversations that are going on, and this is something that is being worked on towards 2020. So when we have things like war, conflicts, it adversely affects health. One of the first things is that you can't even be medical education is truncated when it becomes a matter of life or death. You can't have students. I mean, the Ukraine-Russia war, students had to be withdrawn from schools, people had to go back home, trainings truncated, medical professionals, some of them came back to my country, Nigeria, to try to find a place again. So once you already have medical education being truncated, you can't even build any necessary competence. So peace is very important. Stability is important if we're going to be able to get education. So we find out that for the WHO caseload, like 80% of their caseload and like 70% of their humanitarian drives or their humanitarian aids go to these war-torn areas, to show you that it's very important to have peace and stability before you can actually have anything else. Once you have war, you have things like disease outbreaks. Automatically, we don't have access to clean food or clean water. Overall health indices begin to plummet. Mortality and mobility would begin to be on the rise because hospitals will not be able to function well. Everything will become just a matter of emergencies and all of that. Emphasis will go towards food and water, and less emphasis towards medicine and accessing any form of healthcare. So you already see that already affects the health indices. Children will not get vaccinated. You have infectious disease outbreaks when you have internally displaced persons living together in camps and all of that. And these are the things that war brings. you don't have access to drugs, malnutrition, you don't have access to good food. And all of these are like the baseline. Your students will not be able to learn anything. They won't be able to have access to unhindered training. They won't be able to build any competencies. They won't be able to learn any leadership skills because everybody's fighting for survival. And in cases where you already have these war-torn areas, health can also be a driver towards peace. So you also have these humanitarian aids coming, and you have healthcare professionals, even though they may not necessarily, maybe students may not be in school, but you have people volunteering to help communities, and things like this bring some form of cohesion in. So if maybe it's like an inter-community conflict, just bringing healthcare awareness and all of that to the community can foster some form of peace. Health programs can be powerful enablers in peace building if they are properly chosen. So health and peace are very intertwined. One cannot necessarily exist without the other. You can't build any competencies if there's no peace. So I think that this is the link between health and peace. You can't separate them. So as a continent, we need to place a lot more emphasis on peace and stability so that we can move on from primitive problems that you have to deal with, like lack of access to water, and move on to more advanced things like, oh, how to use technology. But somebody who has not eaten for 3 days because it's a war situation, somebody who is running from bombs and or running from headsmen or killers does not really care about electronic medical records or anything. So we can't make progress as a continent if we don't ensure that we have the peace and stability to do that. So just as my take-home message is that we should continue driving the conversation, we should continue implementing this in our own little way. As individuals, we should all ensure that you take responsibility for yourself, inculcating lifelong learning, continuous education. You can take personal responsibility for it and ensuring that you're able to do that for yourself, ensuring to find out that you open your mind up to technology, you build these competencies, even if it's not necessarily provided for you at the moment, but you can go the extra mile yourself as a student to build these competencies such that when you're done with school, they may not be listening to you now, but when you're done with school, you're an authority, you have a vast range of experience, you have leadership skills, you're communicating well. When you speak, they will listen to you when you're done with school. So such that you can go and head those places and actually be the change drivers that you may necessarily need. People up there right now are not making the change. Those of us who are coming up can be the change drivers when we get into those positions, but adequate preparedness is what you need to be able to effectively function when you get there. So I'll put a full stop to this. It has been a lovely time with everyone. Thank you very much for listening and for having me over.
Thank you so much, Dr. That was really powerful, and highlighting that there's no health without peace, and there's no peace without health. That's a very great takeaway home message. On to you, Dr. Emma. Also, as you're giving your take-home message, looking towards the future, what excites you most about the potential? What excites you most about the potential for the African healthcare workforce to address public health challenges and achieve equitable health outcomes?
Thank you, Cinnamon. I am most excited about the energy, the enthusiasm, the innovative ideas that young professionals and healthcare workforce of tomorrow carry along. And even with limited resources, some mountains have been moved already, some are currently being moved, and some are yet to be moved. Case in point, during the COVID-19 pandemic, we saw how, for instance, medical students came up with innovative solutions to combat the pandemic. Some from, I think it was Jos University in Nigeria, made hand sanitizers from scratch. And another group from Kenyatta University collaborated with engineering students and made a low-cost ventilator that was designed using the locally sourced materials. I think it was called Tibavent. And there were many creative campaigns despite the lockdown. And those are just a few examples of the many magnificent things that excite me and remind me of the inherent potential for you and I to address the public health challenges and achieve equitable health outcomes if only we dared. So let's dare. Thank you so much for having me. It's been an amazing session, and may we dare. Thank you.
Yes, for sure. Will we dare? Sorry, I've just been trying to maneuver this PC. Thank you so much, Emma, for that insight and showing us truly dare to be great. We have the minds, we have everything at our disposal, and I think it's truly phenomenal what we can be able to do even with the limited resources, the settings that we have grown up in, that we can definitely be change agents in our corners and be the change that we envision to see. So, guys, we have come to the end of our session today, and I want to thank our speakers, Dr. Emma and Dr. Francis, for making time for this discussion today and willingly wanting to take part. And for, I'm really grateful for you making time for this session and the lovely insights that you have shared. I have not been able to see your face because I've been sharing my screen, but hopefully after this recording, I'll be able to get this recording and get to see your faces. I know you had opened your video at some or throughout the session, but I've not been able to see that. But thank you so much for coming here today, and to our participants who have joined us today. Thank you so much for staying from the beginning to the end. If you joined us a bit late, still thank you very much for making time for this conversation. It has truly, the discussion today has truly highlighted the critical role of cultivating the right competencies within Africa's future healthcare force. And as you've heard, it's not just about technical skills, but about fostering adaptability, resilience, and innovation to address the evolving challenges and opportunities in public health. I am truly confident that the insights that have been shared today will serve as a springboard for further action. And as FAMSA, we remain committed to collaborating with institutions and stakeholders across Africa and the world to ensure that our health professionals are equipped to tackle tomorrow's healthcare landscape. So together, let's continue working towards building a robust and competent workforce that can deliver equitable health outcomes for all Africans. So thank you once again for your participation. Please don't hit, yeah?
I'm just seeing, I hadn't gone through the chat. I see some people were asking for our contacts.
Oh, okay. Yeah.
Some are
please.
direct messages, others are notes. I don't know if we should share over here or
Yeah, you can definitely drop
maybe
your
you can.
email or your LinkedIn
Okay.
profile for people who would love to reach out to you post this forum. So yeah, Dr. Francis is going to do the same. I think that was an oversight, but feel free to just drop that in the chat section if any of us would want to reach out to any of our speakers today. So mine is just to thank you once again for your participation, and please don't hesitate to reach out to FAMSA. Follow us through our platforms. We're live on Instagram, Facebook, Twitter, I call it X now, LinkedIn as well. Email us through the various, we can email me to our email that is president@famsanet.org. You can also email us at also famsaarchives@gmail.com. If you have any other questions or how you'd like to get involved in our activities, we are just one email or text or chat away. So thank you so much for your participation. Have a lovely night, everyone. And till the next time. Bye, guys.
Bye, everyone.
Bye-bye.
Have a good evening, everyone.